And I firstly call on the Leader of Sinn Féin, Deputy Mary Lou McDonald, please.
Ceann Comhairle, we find ourselves at a crossroads again in our long fight with COVID-19. After 3 very long months of living under level 5 restrictions, our third lockdown of this pandemic, people are, I think, understandably fed up, and indeed many of them are angry and frustrated. Thousands haven't seen a day's work in a year. Many haven't seen family or friends in months, and small businesses are either closing or will struggle to survive. It's fair to say that people have made huge sacrifices to suppress the virus following the dangerous position that we found ourselves in after Christmas. However, infection rates remain very high. NPHET has warned that we are in a very volatile, a very precarious position, and people are now anxious about the possibility of a fourth wave. They're worried about the prospect of a lost summer after months of slogging it out with this virus. So we're now approaching April 5th, the date that the public had hoped would bring some relief to restrictions, and yet people are still waiting to hear the government's plan as to what lies ahead. Indeed, instead of clear communication and strong leadership, what we have had throughout this crisis is mixed messages and kite flying. And to say that people now are at the end of their tether is, in many cases, an understatement. They've seen government fail to do what needs to be done to get ahead of the virus, to pave a pathway for a safe reopening of our society, and this has left many people in disbelief. I refer specifically to a stuttering vaccine rollout, a failure to adequately ramp up testing and tracing, and the absolute carte blanche that have been given to meat factories, for example, with devastating consequences. But I think it's the refusal to deal with the issue of international travel that stands at top of the list. The lack of common sense in government policy is absolutely mesmerising, because the situation is that people can't go 5 kilometres from their home, but have to watch as up to 10,000 people a week arrive here from abroad, many of which are non-essential trips, including people on holidays. As early as last May, Ceann Comhairle, public health officials were urging government to implement a full and proper form of mandatory quarantine. These calls were ignored, and this has left us exposed. And in the meantime, thousands have travelled here from other countries. We're 10 months later and government has introduced a scheme that doesn't go far enough. The list of 33 countries is far too limited, and indeed only 2 of those 33 countries in any event have direct flights into Ireland. So we have a half-baked plan. We're left vulnerable to the importation of the virus and to further dangerous variants, and the threat from which has been keenly highlighted in NPHET's latest letter to government last week. Truth is, we need a system of real mandatory quarantine for all non-essential arrivals from all countries. That's the only thing that will get the job done. It will send a message to international travellers that now is not the time to come here.
Thank you, Deputy McDonald.
The task now must be to reopen as safely as possible, as soon as possible, and ignoring the need for a proper quarantine system jeopardises all of that.
So, the time is up. Yeah. Well, no, the time is up, Deputy. I'm sorry. No, please. You're way over time, Deputy. Thank you. Thank you very much. Taoiseach, please.
Well, could I first of all say that the situation in relation to the virus is very fragile. And I recall when I came in here early this year, when we had 42,000 cases in 1 week, we had 2,000 people in hospital. And I made it clear on that occasion that I wanted to see a persistent suppression of the virus. Now, we currently have, in the last 7 days, we had 3,800 cases, and we have 325 or 329, maybe latest, in hospital. The point there is that the sacrifices that the people have made has had an impact on getting case numbers dramatically down from that January figure, getting hospitalizations dramatically down, and the numbers in ICU, which are currently at 76. That needs to be said. The level 5 restrictions have worked effectively to bring numbers down very, very significantly from where they were. That needs to be acknowledged, and people need to know that, and not to be given mixed messages by the opposition consistently and trying to blur the facts. But the numbers are still high, relatively high, compared to wave 1 and wave 2. And the fundamental reason for that is we're dealing with a variant that is highly transmissible and more dangerous. And that's the context. And we've been very clear that increased mobility can be a factor in facilitating the spread of the variant. And that is why we are currently in level 5. And I've been very consistent in saying publicly and in every fora, no decision has been made in relation to the post-April the 5th situation. No decision has been made. And we'll be engaging with public health advice and other research in relation to this. We do acknowledge, of course, the enormous stress and strain and difficulties the current lockdown is imposing on people in terms of their personal restrictions of their freedom and their liberties, in terms of being within 5 kilometres, and in terms of not meeting up with others. But the reason for that is we do not want to go back to a situation where we have 2,000 people in hospital, or indeed that we have 42,000 cases and so forth in a given week. And that's what we must avoid. And the variant is essentially a new virus in terms of endeavouring to contain it. And that governs how we will approach the phase after April the 5th. I'm watching other countries in terms of Czechia, in terms of France now and Germany, Slovakia, a whole range of countries in Europe where the trajectory is upwards. Ours is flattening, and in some of the last 7 days has gone back up. And that's something we need to be taken into account very seriously. And in terms of mandatory quarantining, we're the first country in the European Union to introduce mandatory hotel quarantine. And I want to say to the Deputy, look, I want to try and develop a united front here, but it was the Deputy who was encouraging people and pressing the government to facilitate travel at Christmas time. It was Deputy McDonald was saying that publicly. And the Deputy had her definition of what constituted essential travel. And in fact, up to quite recently, we were saying mandatory quarantine for non-essential travel, never defining, missing the point about mandatory quarantining in the first instance, because once you have mandatory quarantining, it's designed to stop the variant. And it's the legislation obliges government to consult with the public health. It's based on the variant and very high incidence rates.
Thank you very much. Time is up.
Recommendations will come from the Chief Medical Officer in terms of it adding other countries. But we are the first in Europe to introduce this. And I think that should also be acknowledged.
Deputy McDonald.
Ceann Comhairle, the situation is fragile, and that fragility is undoubtedly added to by the reality of increased variants. And the question that arises is, how do we get from under this? How do we carve out a pathway where we can reopen safely and where society and indeed the economy can remain open? And it is very, very clear at this stage that in the absence of adequate testing and tracing, in the absence of a very efficient and safe vaccination programme, and in the absence of the necessary protections at our ports and airports, we will not be in a position to reopen in a way that is safe and in a way that can be sustained. So let me return to my question, which essentially revolves around mandatory hotel quarantine for all non-essential travel. The government has taken a half measure, and half measures won't cut it. The fragility and the danger of the situation has been amplified again here today. The efforts of people to get past this virus have been recorded. What we need now is the government to do the right thing.
Thank you very much,
we need
Deputy.
a full, effective, mandatory system of hotel quarantine, and the government needs to act on this and act on it swiftly.
Thank you very much. Taoiseach.
I think the Deputy needs to define what she means by non-essential travel. Because at Christmas time, the Deputy had a definition of non-essential travel as meaning that people who were coming home to meet their parents was deemed to be, essential. You said that was essential travel. I think you need to come clean with the people now in terms of what you're actually saying in relation to this. We're bringing in mandatory hotel quarantining, countries will be added as recommended by public health, go to government. In addition to the 33 countries that are already on the Schedule 2 list. And that's in addition to a whole range of other measures that we've taken in terms of the obligation on a negative PCR test, in terms of mandatory home quarantining that has been a legal imperative now for the last number of weeks, and in terms of non-essential travel being fined and so on. But, and police checks at the airports. Vaccination is the key approach, a factor as well in terms of dealing with the virus. And up to date, we have over 700,000 people now, 700,000 doses, sorry, have been administered in the country. We are looking forward to a higher supplies in April, May and June.
Excellent. Thank you, Taoiseach. The time is up now, please.
And
thank you.
There will be significantly ramped up vaccines in addition to what we've already done, which has been very effective in bringing down the levels of disease.
Yes.